Morning, Warwick.
Hi, Patricia. So welcome on the first day of spring to our COVID chat. Well, it's obviously been a major for GPs and health professionals in general to work out how to manage patients in this COVID emergency. And we really want to take our hat off to all your GPs who are at the front line, seeing a lot of patients, doing a lot of swabbing, giving a lot of vaccines, and really in the forefront of the fight against COVID. Patricia, how has COVID affected you personally? What's the situation with your family and keeping safe, etc.? Tell us a bit about that.
Well, I think the biggest thing is, for me personally, it's more to do with childcare more than anything else, because obviously level 4, we haven't got support, not even for essential workers, to send kids to school. And so my son, who's 10 years old, he's studying at school. He's doing pretty well, but that means I can't come to work. And we really need to cut down my workload to a bare minimum, although having said that, most of the patients at the moment, if they're not urgent, they're not willing to come to clinic. And personally, I'm only seeing minimal number of patients in person with urgent symptoms. Most of the other patients, we are seeing them as a virtual follow-up. How about you, Warwick?
Well, I'm at a different stage of life, being a little bit older with children a long way away. One of my boys is in Wellington working in Parliament, so he's at the forefront of everything. My other boy lives in Melbourne, so he's had about 220 days of level 3 lockdown and continues to work from home. He works for a Mars pet food company, and he's in the marketing division there, so it really hasn't affected him very much. So for our day-to-day existence, like all other people, we've just been pretty well locked up and going for exercise now and then, etc. So yeah, it's affected us, but not perhaps quite as much as other people. Now, with our practice, that's a different matter, because we're in a very difficult situation, because what we really have to look at is what are the guidelines towards specialists as to what patients we should and shouldn't be seeing. And I just asked a lot of other doctors what they're doing, a lot of other specialists, and it really is quite variable. I heard of a breast surgeon who's pretty much seeing everyone that comes along, because they say the breast cancer patients are all urgent. To the other end of the spectrum, where another doctor I asked in the cardiology practice said, "Oh, that was easy. We've just closed the doors and put everything on answer phone, and we're shut until COVID emergency's over." So in between, there are lots and lots of different iterations of that.
Yeah, I think at the moment the workload is a lot more narrowed towards the type of patients who have essentially urgent but non-acute symptoms that doesn't quite need to go to the hospital. We can still deal with, safely manage them in the community, but definitely not the relatively well patients with palpitations. That's relatively sort of a non-cardiac in origin.
Yes, I think it's quite a difficult decision. The guidelines that we've had from the Ministry of Health for these, they say that if the patient is likely to suffer some consequence or deterioration in the next 6 weeks, then they should really be seen by the doctor, whether that's a person-to-person consult or, where possible, one via Zoom or Google Hangout. But so that's really quite a broad sort of thing, because it's very hard for us to tell which cardiac patients actually have something bad wrong a lot of the time. So therefore, initially when we started off, we were very conservative, weren't we? But now we're seeing a few more patients, particularly if we're not sure what might be.
I think the tough part for us, for our practice, is the cardiac cath lab is closed, both at Intra and Ascot Angiography. So there's a limited amount of stuff that we can do. Essentially, there's only medical therapy if they're not unwell enough to go to the hospital. You have sent a few patients to the hospital urgently, right?
Yeah.
So that means it's quite tough on a small number of people that who's being scheduled for procedure. We know they've got moderate to severe disease on CTCA, for example, but we have to review their symptoms regularly to ensure they're not going to have any adverse events. So that small number of patients does make me worry about them a little bit.
Well, I think that what's actually happening there is, as time goes by, the hospitals are reviewing these closures, and I think that we just got an email from the chief executive of the hospital yesterday saying that hopefully next week, if the DHBs are happy and things are looking reasonable, that we should be able to start doing more urgent cases in cath labs, in the private cath labs, both here and at Mercy Hospital next week. I think it raises an interesting issue because, really with COVID, we're asking individuals to make a sacrifice mostly for the good of society, because the risk to any individual, most of us, is pretty small, but the risk to society is pretty high. So that's all okay, except if the risk to the individual who's got a disease is significant, then you're asking them to make that sacrifice. And it's not, the government has been quite clear in saying that anyone who's got a medical need should really go and get checked out. So I think that's an important message. So as far as referrals here go, we're very happy to see anyone who you feel is requires that. For example, yesterday I had a call about a patient who had a blood pressure of 220 over 120, completely unmanageable, and despite being on four medications. Well, clearly that's someone that needs to be seen either here or at a public hospital. I've had calls about patients with chest pains, rapid atrial fibrillation. All those conditions need to be seen, and we are having clinics here, but we're just using very careful personal protection. Only one patient is coming into our office at a time. They don't see any other patients. They don't sit in any waiting room. They just come straight into our consulting and management area. We've got limited staff here to see them, and we're all wearing gowns and masks, etc., and washing our hands. And so hopefully we're operating in a very safe way. So personally, how does the COVID make you feel? Like
I think this time the lockdown is a bit different to the first level 4 lockdown. I feel like there's a little bit more sort of stress level overall for everyone, mainly because of the nature of the Delta variant, even though all our staff are vaccinated. So there's a lot more, I feel like there's a lot more uncertainty, but I think overall everyone's doing well in terms of following the rules. And we are trying to do our best. I'm sure the GPs are as well.
Well, turning now to my other role as sort of the administrator and manager of our practice, there's a lot of compliance sort of issues around that, which we have to be very aware about, particularly about mask wearing and using proper masks and having them fitted properly. It's now the employer's responsibility to make sure all the staff have adequate supplies of masks and they're fitted properly. And one of the other thorny issues, of course, is about vaccination and staff that don't want to be vaccinated, and what they should, whether they should be working in either GP practices or specialist practices. And I think that's going to become clearer as time goes by, because I suspect the government is going to really just pass a law saying that all people in frontline healthcare should be vaccinated, and if they're not, they really shouldn't be working in frontline healthcare. That's pretty much where that's going. What do you think about that?
I think I personally think vaccination is essential for healthcare workers for so many reasons, and not to mention that we potentially will be facing the next generation. So the South African variant, the current vaccine may not be as effective, and also the effectiveness overall is likely to drop over time. So there's a lot of uncertainties. I think it's good that if we're working as a team, that we need to ensure safety for everyone.
What do you think is the medium-term sort of outlook for us in managing this COVID, and what do you actually think is going to happen?
I think for the medium term, it's very likely we could be facing another one of these. There could be some changes in the regime or the type of vaccines we're getting. So I think the whole world is changing with the situation.
I agree with that, and I think that the thing that hasn't really been emphasised at all is that the medical treatments for people with COVID are improving, and I think there's quite a few trials going on now with drugs looking at how to treat people who do get COVID badly, and I think the outcome from catching COVID is going to be better as time goes on. And I think that while the virus may mutate and be more catchy, I think eventually vaccines and things will, to some extent, cope with that. But I think it's something that we're going to have to be coping with for a long time. And my biggest fear is what's going to happen when New Zealanders are all vaccinated and we say we're going to let the virus in here. I think that's going to be our time of greatest stress, because there'll be quite a few people in hospital with COVID, and people still having to use public health measures without being sort of locked down. It's going to be very difficult to manage.
Yeah.
All right. Well, thank you,
Okay.
Patricia.
Thank you, Warwick.
I hope you've enjoyed listening to this, and we're happy to see any of your patients that you're worried about.
Yeah.
Thanks.
Okay. Thank you.